It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health Wellness Center. We've got a great guest for you today. In fact, this is a new service that we're offering at the Wellness Center, and we are just so excited about it, aren't we, Dr. Hotze?
Thank you, Stacey. You're exactly right. It's an exciting program today. You know, at the Hotze Health and Wellness Center, we want to help you get on a path of health and wellness naturally so you enjoy a better quality of life, you feel better. But as you feel better and improve internally, you want to look good as well. And we are bringing on a new service here at the Hotze Health and Wellness Center, plastic surgery. That's right, plastic surgery at the Hotze Health and Wellness Center. And we're affiliating with Dr. Mark Barlow. Dr. Barlow graduated from the University of Texas in Austin, ended up with an engineering degree and went off to MIT and Harvard, where he spent 5 years studying engineering and biomaterials. At that point, he decided to go into medicine, and he came back to medical school at the University of Texas at Houston and did a 5-year surgery and plastic surgery program at the University of Texas in Galveston, and he's been in practice in the Clear Lake area since then. I've known Dr. Barlow for a number of years. He's treated and performed surgery on literally thousands and thousands of individuals. And so in visiting with him, we thought it would be a great opportunity for him to affiliate with us, at least on a day a week, where he could provide you, our guests, with some special services. And there are 4 particular services that we're going to offer here at the Hotze Health and Wellness Center with Dr. Mark Barlow. The first is Botox treatment. The second is fillers. The third is blepharoplasty or eye lift. And the fourth is lips. And Dr. Barlow is going to explain those to us today so you can understand what that entails and what kind of benefits you'll have from that. But most importantly, I want you to remember that all of us, not only do we want to feel well, we want to look our very best. And the most important place to look well is in your countenance, in your face. And as you know, as we age, things tend to sag. And we don't look as good as we get wrinkles, and we just don't look like we used to look. And women, I know, try to cover it up with makeup, but it doesn't work in men. We just kind of let ourselves look like a bunch of old Lone Rangers or Marlboro men. But it's sure something that we need to consider as a great possibility to help you improve the quality of your life by improving your appearance. So, Dr. Barlow, thank you so much for joining us today.
Well, good morning, and thank you for having me. What I like about plastic surgery, it was either restorative or improving function or appearance.
Right.
So much of surgery, general surgery, is pretty much just ablative. You're removing something because it's caused a problem or gone wrong. And orthopedic surgery was interesting, but it wasn't the same creativity that you need to do plastic surgery, because people come in with any myriad things they consider problems. Some are functional problems. Some are, I don't like the way this looks or the way this feels. I lost 100 pounds. What do I do with all this skin? So a lot of it is either restoring function or giving them back something they maybe never even had. And so that to me is interesting, because every problem is a little engineering problem, but then there's the art and finesse of how do you actually make the tissue respond. Designing in metal is one thing. You just cut it and it works. Skin's elastic. The underneath changes with time. Just the whole thinking process and then the implementation myself with my hands is what has been attractive to me.
And you really have an engineering background, so you like working with your hands. You like working on things, and I was the same way when I did 1 year only of surgery after I got out of my first year out of med school. I did a surgery internship, so I liked. You could fix something. You could go and take care of a problem. And the wonderful thing about plastic surgery, you can really help people improve their appearance, which increases their confidence and really their the way they feel about themselves, their self-image, and that's so very important. Now, talk about I mentioned that we're going to talk about 4 things that you do in the office simply that you would be doing here at the Hotze Health and Wellness Center. We're going to talk about Botox. We'll talk about fillers. We're going to talk about blepharoplasty, eye surgery, and also lip surgery around the lip or fillers around the lip. So why don't you talk to us first about Botox? That's simple. Explain to us about Botox and what the use of Botox is.
Okay, so Botox is one of the botulinum toxins we have that are cleared for use in people. And basically the toxin binds to the joint between the nerve and the muscle and inactivates it, so then the muscle doesn't get the impulse to move. So a lot of people have, 11s or crow's feet or forehead lines like I do that they don't like and they want to treat them. So put a little toxin in, you get 3 to 4, maybe 5 months eventually of stabilization of the muscle. And so wrinkles that are starting don't get deeper and actually relax a little if you intervene early enough. I've got people in their even 30s coming routinely because they don't want the wrinkles to form. And so by blocking them, they never do. So we figured out this would work because people would have blepharospasm. So one eye would twitch all the time. And it was really annoying because it's off-putting and it's annoying to the person. So they started doing little doses of toxin. Toxin in the wrong place kills you.
Right.
That's what botulism is. So, but the purified toxin around the eye, okay, the spasm stops, the patient's happy, but 5 years later they're like, well, I don't have crow's feet on this side like I have on this side. And so that's sort of what led people to think, oh, we can do this for aesthetic purposes.
Right. And so when a person has Botox treatment, how frequently is that done?
It's every 3 to 4 months at first. Okay. If you consistently treat, the muscle, it sort of atrophies in between, and then it has to get stronger afterwards. And once the signal comes back, and so I have people who come twice a year that have done it for several years.
Good. And the next procedure that we're going to be performing here, or you'll be performing here at the Hotze Health Wellness Center, is fillers. So tell us about fillers. Where are fillers used? What do they do? What are they made of? How do we? What is it? Yeah, what does it accomplish?
Sure. There's several different classes of fillers, and they have different properties. So probably the most commonly injected ones are going to be hyaluronic acid based things like Restylane, Juvederm. It's a clear gel. In the outer layer of the skin is the epidermis. The next layer is the dermis, which is collagen, which is the strong stuff. Elastin, which is stretchy, and then sort of all the stuff around it is mostly hyaluronic acid. So it's what's in our skin anyway. When I was still in med school, probably they were using mostly collagen as a filler, and it came from a cow. And that's fine. It holds volume, but then a lot of people got allergies because it's bovine and not human.
Right.
So then some people extracted hyaluronic acid from rooster combs because we eat roosters, so what do you do? The combs like waste material. So you get that, make it a gel, and that's also good except for the allergy problem. And then they finally figured out how to do recombinant human hyaluronic acid out of yeast or bacteria. I don't remember. It depends on the company. But basically it's our genetically identical hyaluronic acid. And now we have a whole family, and there's 2 or 3 big companies that do it, Allergan being one, Galderma being the other, that have different moduli of elasticity, so different stiffness, different viscosities. So you can have a stiffer one that maybe is a little more like bone for deep fill. You got softer ones that are maybe better in lips because they don't feel lumpy at all. Those are the most common. Then there's there's at least 3 other broad classes that do a little more structural replacement of volume. So one of the problems that happens when we age is everything's, I don't like that I've got jowls now. Well, the jowls started in your cheek and they've settled. So part of it is skin quality, which we can, general wellness helps with that.
Right.
But then there's laser treatment or skin pen with microneedling that also helps improve the skin quality. But part of it is we actually deflate more than we sag. And so restoring cheek volume tends to lift the jowls back up. Look at an 18-year-old person's face. They are much plushier than we are by the time you're, in your 50s like I am. And that's just volume loss. And I weigh almost the same thing I wore. I'm a little bit heavier than I was in high school, but not by a lot. So that's just sort of the general nature of that. And so restoring the volume, along the tear trough area, in the cheeks, we lose our chin pads, then we get, a crease down here and our chin looks small. All these things accentuate the drop of what cheek volume we have to make our jowls. So it's sort of a multimodal approach for many people.
Well, how will that affect fillers? How will that affect the gobbler effect that I've got right here on my neck?
So part of it is settling from the cheek.
Right.
And part of it is thinning of the skin, the tissues in the neck,
right.
too. So we had more volume in our neck. So for most people, a combination of fill that really starts up at the orbital rim level, down through the cheek, not in the jaw line so much, but in the chin, and then some fill in the neck. I do a lot of combo in the neck with filler and Botox to try to get the platysmal bands out to relax that, but then to actually give some volume back so that you don't see only muscles and veins, which look at an old person's neck, and that's kind of what you see.
Yeah, well, look at mine.
Yeah.
Okay. So fillers are important. In the procedure to do fillers normally on a person, it's going to take, what, 15, 30 minutes? How long?
Yeah, somewhere in that range.
Okay.
And then
And
depending,
how long will it last?
so it depends also on the filler. So the hyaluronic acid, most of them are 9 to 12 months. Some of the ones we use for deeper fill, like Voluma, last maybe 12 or 15. The way they do their advertising lasts up to 18 months. Well, that's like you get it, but then you get a little more somewhere along the way. So
routinely, if somebody's gonna take care of their wrinkles or the furrowing they're having up in their face and the sagging, they're going to do that if they want to keep up on an annual basis.
much an annual basis is what to expect.
Okay. Tell us about eyes. A lot of people, as they get older, begin to get saggy upper lips. Upper eyelids. You look at my eyelids, and you can see how they've begun to sag, little puffiness under the eyes. So tell us about a blepharoplasty, which is an eye lift surgery.
Sure. So there's a couple things that feed into that. Partly we lose the padding in our forehead, so then there's less sort of plump to hold the skin, if you will, so
Right.
the skin settles. So my brows are pretty low, and I could probably use a brow lift, except I'm also having my hairline move back, so where do you draw the line? But then the excess skin is very easily addressed. For a lot of people, their upper lid only has extra skin and not extra fat. 20, 30 years ago, everybody's blepharoplasty pretty much was take all the skin you can and any fat that wants to pooch out. Well, then you ended up with sort of a marble in a socket,
Yeah.
and their orbital area was so deflated they actually looked worse than yes, the skin's not making a shade, but they don't look good. So now we're very careful with fat. Sometimes fat repositioning, sometimes adding fat along the rim where we tend to lose it, which accentuates if there is fat pooching out in the lower lid. Not having fat right below it where everything attaches to the bone makes it way more obvious. So for a lot of people, it's only skin. For some people, it's skin and fat. And that's easily done. Prep the skin, inject it with local. Once the local's in, you don't feel anything.
And that can be done in the office.
That can be done in the office.
Now, is that just uppers in the office? Can you do lowers in the office as well?
Depends on the lower. If I'm digging after fat for the lowers, for want of a better word, then I usually do those with at least deep sedation because
Right.
it's harder to get enough numbing in there that the fat doesn't hurt as it's being
Right.
dealt with.
Now, we were talking about earlier fillers. And I read where fat is sometimes used as a filler. Now, where do they get the fat to fill?
I do a lot of fat grafting. My preference is to grab the fat from wherever it's the last place the person loses weight. So I'm counting them not to gain weight, but if they go up or down a little bit, I kind of want it to be their stable fat location. So for a lot of people, it's the lower tummy or love handles. Numb that area up. Use a cannula under just manual suction for a lot of people with just a syringe. Basically, get the fat out. It gets centrifuged so I can isolate good, stable, graftable fat, and that's what I use.
Now, why would you use fat as opposed to some of these products that are on the market, the hyaluronic acid?
Well, the advantage of fat is it's yours and it works as a graft, so it lives there in the new location. So part of I use a very tiny cannula that puts basically little spaghetti stripes of fat in multiple planes, multiple vectors but it's small enough that the blood supply can grow into it and keep it alive. So it lives there
Okay,
and persists.
So what would be the reason somebody wouldn't use fat all the time as opposed to hyaluronic acid?
There's more sort of operative time because now I got to prep somewhere, take a little
Right,
bit of fat out.
right.
So we'll have two places that hurt instead of one.
Right.
And it's not ready to go. So a lot of people just want to pop in, get it done, and go.
Right.
Which is off the shelf is great. Most people I say, let's do at least one round of off the shelf stuff. And if you like, the look and you like how I feel you, then let's talk about fat. Same thing with Artefill as a filler that tends to last for years and years and years. So it's tiny little beads of basically a polymer plastic that are big enough, they don't get extruded like a splinter, but small enough our body doesn't gobble them up. And so what does the body do? It just lays collagen around them. So it's a collagen induction thing. And I always say, well, for those also, let's do at least a round where you see how I feel you before you commit to me for 5 or 10 years or more. I mean, the plastic really doesn't go anywhere. The data, I think, is out to 8 years now that it's
Right.
stable fill.
In the fat, if you used fat for the filler, that would last how long?
As long as your fat would last. I mean, it gets
Indefinitely. Yeah.
indefinitely. The nice thing with fat too is because it's not only mature adipocytes. It's it's what's in the fat tissue, which includes potentially at least some pluripotent stem cell like things. We can't say they're stem
Right.
cells because no one's studying that.
Sure.
And if we said it was, and then they'd probably just stop us from doing it.
Yeah.
But there's clearly improvement in the skin that gets the fat
Sure.
years down the road.
Well, we know
compared to before.
mesenchymal fat cells. I mean,
Yeah.
if you get your stem cells from the fat, those are mesenchymal fat
Sure.
cells, and we know fat has stem cells in them. That's where you get them.
Yeah.
If you're going to get them from the belly, you're getting mesenchymal stem cells. So I can see how that could be.
Yeah, Dr. Coleman did some of the earliest work on structural fat grafting. He's up in New York.
Right.
And one of the things he shows, when you go to conferences, the fat looks nice, but the skin gets better for years and years and years because of this newly transplanted stuff
That's very
in
interesting.
its process. Yeah.
So, what percent of your fillers would you say are fat? What percent do you use hyaluronic acid?
So the injectable type patient who just comes in, I want filler,
Right.
pretty much they're all going to be off the shelf stuff. People are going for a facelift or a blepharoplasty or some other surgical procedure anyway. They're like, oh yeah, I want to do that definitely because I'm asleep, and it's like
Right.
a freebie to me because maybe I'm doing lipo on them too, and then I would just throw it away. But now they get to use it.
Sure.
So for the pure fill people, it's probably only 5%. It's relatively small who only want fat, and they're not doing anything else. It's just the way it kind of
And
shakes
how
out.
how much longer? If you came into the office and you wanted to do fat, how much longer will that be? An hour procedure because you've got to draw that up and spin it out.
Yeah,
You got to go spin it and you put it in centrifuge, spin it, I guess, and just take it off. Can you take it off immediately? You
Yeah.
have to-
Yeah, it's 3 minutes at 3,000 RPM.
Okay, there you go.
Yeah, so hour and a half at most. Depends on how much we're putting in and where. But
Okay, and then finally, some people have their lips improved, or they think they have them improved. I don't know. I've seen all
Sure.
different kind of results on these lips. I've seen some lips that get big and it just looks bizarre. So, what are the indications for a person that wants maybe some improvement in the lips? Maybe they got too thin, they don't look right. I don't know. What are the reasons people get lips done?
same thing is kind of like the rest of the face. The lips do tend to involute. They get smaller over time. Our upper lip gets longer and flatter. So one of the, look at a mouth that's barely open. In a young person, you see kind of upper teeth and maybe the split between upper and lower. Older people, it's all lower teeth because everything's kind of settled. So very commonly using hyaluronic acid in lips just for volume replacement. And that generally means around the mouth, not purely in the red part of the lip. The other thing that happens, look at a young lip versus an old lip. The white roll that kind of defines where the lip stops goes
Right.
away. So I have a lot of women who tell me I want my white roll better so my lipstick doesn't bleed. And it takes out some of the little radial lines,
Right.
the little up and down
Sure.
creases. They'll tell me I never smoked, but it looks like I have a smoker mouth.
Yeah.
They don't like the lines. And so that's one way to get rid of those. The other thing can be done for some people is like take out a little skin right at the base of the nostril and actually remove skin to help roll the skin, the upper
Lip
lip.
up,
So
yeah.
the skin gets shorter and then more vermilion or red part shows.
Right. Well, explain to our listening audience how you're going to function here at the Hotze Health and Wellness Center. We'll schedule appointments. People will come in, say they want to have some filler done. Will they need to have 2 visits, or will you be able to visit with them at that time and then do the procedure during the same day?
It can be either way. So either they can come in, get a consultation, we'll come up with a treatment plan, and then they can say, I'm ready to pull the trigger now, or I want to stage it. I mean, people do many, many different ways. My sort of practice is to go conservatively. My wife always accuses me of spending their money or taking their money like I'm spending my own, and I'm a little frugal. But I'd rather sort of sneak up on the endpoint than then, bam, there it is.
Right.
Because for some people, it's a very dramatic change. I mean, and it's, one, it's expensive, but 2, it's everybody in your family circle is going to know you're different. Some people just want it. They don't care. Some people are like, you know what, I need it to be a little bit more gradual. Let's do some of the cheek now and a little lip, and then we'll come back. I'll come back in a few weeks, just enough times for people to get used to it. Now, right now with the masks, that's all been a little bit different because who
Nobody
sees you with a
knows.
mask anyway? Covers all, if you get a bruise, it's covered. And by the time we take our masks off, people aren't going to remember what you looked like before exactly anyway.
Well, tell us about that. On the fillers, do you have much in the way of bruising?
You can.
Yeah.
I mean, it's a small needle, but it's a needle, and they're usually pretty short to keep the push
Right.
force down for good control.
So how long does it take after a filler before everything's cleared up?
It depends on the person. Some clear bruises faster. I like to use Arnica montana as a, sort of an herbal help for that.
Right.
It'll cut the bruising duration down by half or more. We can do some laser therapy with, the reds and the LED to help minimize that. Untreated, some people have bruise for 3 weeks in some form or another. Now, it's not a big purple blotch anymore, but it has to
Right.
go through the green to yellow to fully faded
Imagine.
transition.
And how about on blepharoplasties? You'll have
It's
the same.
similar. You'll have most of the puffy will be a couple weeks. You'll have suture that I remove at a week, typically. I don't like dissolving ones because to actually break them down is inflammatory, and the skin is so thin in the lid it leads to a scar taking longer
Sure.
to look normal. So the scar for blepharoplasty, for the lower lid, it's hidden right under the roll where the lashes are. For the upper lid, it's in the crease. There's
Right.
a tarsal plate is the stiff part of the right at the lid margin, and then where that tends to fold is where the scar gets hidden. And it'll be pink like any new scar for several months, and then once it fades,
You never see it.
You never see it.
That's great. Well, Dr. Barlow, this is going to be exciting, rolling this out here at the Hotze Health and Wellness Center and being able to offer this to our guests. So I hope each one of you takes an opportunity to consider the possibility of not only improving your health by getting on a good health and wellness program so you feel well internally, but consider the potential you have in improving your appearance. And that's always important. Everybody likes to look their best. And this is one way we felt like we can offer a better service to each one of you is by providing the opportunity for you to be able to work with Dr. Barlow on helping your facial appearance. And if there's any other plastic surgery needs, Dr. Barlow also does that. He's, one of the lead plastic surgeons in Houston, and he's the head of the plastic surgery department at his hospital down in the Clear Lake area. So he's very well trained and very well experienced. He has the expertise to help you look your very best, and I hope you'll take advantage of this. So don't hesitate to give us a call here at the Hotze Health and Wellness Center if you're interested in that. So thank you again, Doc, for joining us.
My pleasure.
And
Thanks for having me.
thank each one of you for joining us as well.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.